first one is what we call business literacy. Our action plan was to develop productivity to improve and reduce labor costs. Shawnee has been working with a consulting group, and she will be here. If you remember, we got a $20,000 grant. We had this group has come in and done some work, and she's bringing some benchmark data tomorrow. We're actually going to have our last meeting with her tomorrow. So we're working on getting this defined, and we've been talking about benchmark for many, many years. That's another one, Tommy, we've been talking about a long time, is benchmark. But we want to try to get that really defined as to what our benchmarks are going to be. Implement a revenue cycle team. We have not yet done that. Kathy and I've talked a lot about this. We've identified members of the revenue cycle team. We'll probably wait until we get a new CFO on board to actually start this. But we want to identify that team and have a group that meets at least once a month that takes the patient from the admissions and registration all the way to collection, so that we're not missing any piece of this, because hospitals are notorious for working in vacuums, and everybody has their own little niche, and sometimes they don't communicate well until 6 months down the road we find out, oh, we haven't been getting paid because we didn't have this done over here. So if we can all get together and meet on a monthly basis and say, this is where, you know, I'm having problems with this, then we can address it right there. And we're going to be able to, I think, make a difference. And again, I put just a prior year-to-date loss and current year-to-date loss, just to kind of show you where we have come from. We want to continue to focus on those benchmark measures. We want to evaluate new service line development. And we want your input into this, where you feel like we need to go in developing or looking at low volume areas. We do have some low volume areas. We want to turn those into profitable centers if we possibly can. One example is home health. I think we're just starting to see a turnaround in our home health. We have had a turnover in the director position. We now have 2 co-directors. We had some problems in billing. We have replaced the billers, not necessarily that it was the biller's problem, but that we have brought some people on that maybe had a little bit more experience, and we have given those billers some training. So training and knowledge makes all the difference in the world. You got to know what to do to be able to do it correctly. So that's one of the things that we've had with the home health. The wound care center, we brought that on just recently, and we've added 1 surgeon to the surgical clinic. So we've made some progress in adding at least 1 service line in this past year. We want to restructure or discontinue services that are not self-sustaining or critical to MRMC. Refine physician recruitment as identified in physicians' needs assessment with input from community board, physicians, and leadership team. As I said, we brought Dr. Menendez on board in this past year. Of course, Dr. McCauley came in August of last year, so we've actually brought 2 on since we developed this. Dr. Schoenfeld, we've been sending out letters for specialists, because that was one of the areas we really wanted to focus, is to get some specialists in the area. And Dr. Schoenfeld is a nephrologist located in El Dorado, and he has committed to, he and someone else that's in his clinic, I think, to twice a month here in our clinic. Dr. James Hurley is a cardiologist in Texarkana. He's shown some interest, and we currently have the Medical Center of South Arkansas. Dr. Volker is coming, probably seeing close to 27 to 30 patients every other week, doing a lot of outpatient procedures in our hospital. And we also have a neurology group in Texarkana that's shown some interest. So we're putting out some feelers to try to get that, so that this will be support to our physicians here in town, so that they don't have to send our patients out of town to meet with the specialists. And of course, we want to continue to research and write grants to begin or to improve programs, and we would recommend to continue continue that. So that's our business literacy, kind of where we, what our plans were, what we've done, some of the things we haven't completed completely, but we've started on. And again, we're looking, we don't want it tonight, but I'd like to give you this because we would like some direction from the leadership team. We'd like to have some direction so that we'll have a couple of months to put into place a plan of action for the next year so that we can bring this to you in September for approval at the beginning of our new fiscal year in October. The next one is service excellence. Utilize the survey process. We've been doing that. Implement focus plan to improve inpatient and outpatient, inpatient and ED patient satisfaction. Flip over to the next slide, just and we'll come back to this one in a minute. But this shows what we've already done. Our goal, of course, was to have our goal, if you look on this, the overall sheet, we were to utilize a survey from LSUS, and we wanted 90% scores. Look at our scores here versus the state average. I think we've probably met and exceeded most of those this past year. This goes from the fourth quarter of '09. So I think we've already done that, and that is something that we would continue. Now, whether you want to continue to have that on as a strategic plan would be something that you could let us know whether you want to do that or not. Okay, let's go back to the other slides. Okay, the next thing is to implement a patient advocacy program. We are now into the second month of implementation with the patient advocacy program, seeing over 90% of the patients. I'd asked Julia Whitehead, who serves in as the foundation director, to do this. Sometimes she's really, really busy with foundation work, and sometimes not so much. But this has really been an added benefit, I think, to Joyce, and Mike could speak to that as far as the nurses. But it's another person. She takes a card. It's a kind of a larger size business card that has her name, Julia Whitehead, patient advocate, and her telephone number. She sees every patient after they've been here within 24 hours. And we want to know, before that patient goes home, what the problems were. Like, is there something in the room that's not working? We don't want them to go home and say, oh yeah, I laid up there in that bed for 3 days and nobody did so-and-so. We want to address it now. And so I think that Joyce can probably tell you, some times when that's already worked. And so she's not really representing any department, she's representing the hospital administration. So I think we've seen some really positive things come from that, so we'll certainly want to continue that.